Okay, nitroglycerin, commonly sold as Nitrostat, Nitrobid, Tridil, either any of those, or generically as nitroglycerin. It is a vasodilator. The way it works is it causes smooth muscle relaxation, lots of different areas in the body, not just in the vasculature, but it can also do that in the uterine, stomach, lots of different spots. Lungs as well, it's possible. So the main thing we're looking for, though, is the vasodilation effects with that. When you get those effects, you also get a decrease in preload and afterload on the heart, and that can reduce the myocardial oxygen demand, so the heart doesn't have to pump as hard. Pregnancy class for it is C. Oops, get that to work. There we go. Slide 2. Indications for it's going to be chest pain, acute coronary syndrome. Hypertension can also be another indication for it. And then CHF exacerbation with pulmonary edema. If we open up all that vasculature, it's going to help fluid escape out of the lungs and return to other parts of the body, and at least they'll be breathing better. Some contraindications: hypotension, hypovolemia, hemorrhagic stroke, or any type of head injury, severe bradycardia or tachycardia, either one of those, right ventricular infarct, we'll talk about that in a second, and then erectile dysfunction meds in the past 48 hours. With the erectile dysfunction meds, those can cause a drop in blood pressure, and then if we give nitroglycerin on top of it, it can cause a drastic drop in blood pressure that we might not be able to correct. So we want to avoid those. There's a couple of them that say it's safe within 24 hours, and then others that say 48 hours. So it's best just to stick with 48 hours and you're good to go. With the right ventricular infarct, we want to rule that out prior to giving nitroglycerin. So make sure we're doing our 12 leads before you give nitroglycerin. Rule out a right ventricular infarct, look for your inferior infarct, then do a right-sided EKG, do a posterior EKG, should be doing those, and rule out that right ventricular. So with right ventricular, it has to do with, if we're reducing preload on the heart and reducing all the vasculature and causing vasodilation, then the heart might not be able to fill back up, especially if that right ventricle is damaged, as in the case with the infarct. So it will drastically reduce blood pressures and bottom out patients and could possibly kill somebody if they already have a damaged right ventricle, and then we get rid of all the preload that they have. So that's the deal with that. Adverse reactions: headaches, dizziness, weakness, reflex tachycardia, syncope, hypotension, nausea, vomiting, diaphoresis. All those are possible. Of course, hypotension will definitely be a side effect. We'll get, to some degree, we'll get hypotension or a blood pressure lowering effect, if you will. They might not become hypotensive, but it will lower the blood pressure for sure. Drug interactions: it does have an additive effect when used with other vasodilators, like we talked about with the erectile dysfunction meds. And we also want to make sure we are using a separate IV line. It's not real compatible with most other IV meds, so if we can get a separate IV line with that, in the case that you're having to give it IV. For adults, standard dosage is sublingual, 400 micrograms every 5 minutes, up to 3 maximum, and that can be given as a either a pill that you stick under their tongue or as a spray, and you try to squirt it underneath their tongue, either one of those. And then also, if you're trying to give it IV, then it's going to be 10 micrograms per minute is a starting dose, and then we're going to titrate that up every 5 minutes or so. You'll adjust it and try to titrate it up to effect to reduce that chest pain while maintaining blood pressure, and you're not causing crazy tachycardia, stuff like that. For the kiddos, it's not generally recommended. Not going to give that really. And then duration of effects, the onset's going to be 1 to 3 minutes, peak effects in 5 to 10, and then with sublingual meds, sublingual nitro, it'll last 20 to 30 minutes, and then with IV, once you stop giving it, it's only going to last, effects of it's only going to last 1 to 10 minutes or so. Something to keep in mind: we do want to protect it from light and control the temperature on it pretty well. It starts degrading once it's exposed to light. And that is really about it.